The Delta variant has reared its ugly head in 49 states. Just when Americans were breathing a collective sigh of relief about the pandemic, still there's some good news. Research shows the Pfizer and Moderna vaccines may last for years, even without booster shots. So effective are they against the Delta variant? CBN's Jenna Browder has more from Washington.
The Pfizer and Moderna vaccines might be even better than experts originally thought. There is concern, though, over some of the variants, especially the highly contagious Delta variant. New research suggests the two vaccines could offer protection for years, even after antibodies start to fade.
These data suggest that some level of immunity will be long-lasting. How that translates into actual protection, I think, remains to be determined.
The findings mean those who have had the vaccine might not need a booster shot every year. Still, there's a small possibility you could get COVID-19 even if you've had your shots. The CDC doesn't track every breakthrough infection. For the most part, though, their cases are less severe. But it reports about 4,000 out of 150 million Americans who have been vaccinated have been hospitalized or died from COVID. The virus does continue to change, and that has experts concerned. The Delta variant now spreading to 49 states.
Those individuals that we are still seeing that are not vaccinated and taking a lot longer hospital stay.
And in at least 5 states with lower vaccination rates, hospitalizations are up: Missouri, Arkansas, Louisiana, Nevada, and Arizona. Health officials fear pockets of dense outbreaks in these areas. Louis Michael and his wife Patty ended up in a Missouri hospital after putting off the vaccine.
I hope people do think about getting the vaccination. It's your prerogative, but I wish I had done it to just avoid this.
Both are now at home and on the mend. And as we approach the July 4th holiday, the federal government is urging local governments to target high-risk communities with vaccine drives. The White House won't meet its 70% goal by that day, but it's hoping to within the coming weeks. In Washington, Jenna Browder, CBN News.
Well, now, CBN News medical correspondent Lori Johnston is with us. And Lori, I want to ask you a sort of a shocking question. We've heard about so-called gain of function, and I understand that it was against the law for doctors to take a benign virus and manipulate it, and that's what then make it deadly. And is that the case? Did Fauci and his friends at the CDC do this stuff?
Well, gain-of-function research was outlawed during the Obama administration, and then it was reinstated during the Trump administration here in the United States. But gain-of-function research was reportedly being conducted at the Wuhan Institute of Virology. Now, we do know that the United States did fund research at the Wuhan Institute of Virology, but health officials are saying that we did not fund gain-of-function research. So it's sort of a slippery slope there about this gain-of-function research, but we do believe that it was being done at the Wuhan Institute, and many people, including former Secretary of State Mike Pompeo, believe that this gain-of-function research produced the COVID-19 virus that killed so many people, and that it slipped out of or accidentally escaped from that lab in Wuhan because the security measures there weren't very tight.
Well, it's a terrible thing, though, to take a virus that's fairly benign and manipulate it so that it becomes deadly. I mean, we should never do that, should we?
Well, I actually spoke to NIH Director Dr. Francis Collins about this gain-of-function research and why some people do it. And the idea behind it is to get one step ahead of a virus and develop vaccines and prepare for it. So, for instance, we saw that SARS and MERS came from bat viruses and were translated to humans. So the idea is to look at more of these viruses and maybe see how it might become contagious to humans and therefore head it off and get one step ahead of it. That's the reasoning behind doing gain-of-function research, which would be legitimate. And then there are some other concerns that some people might be doing gain-of-function research to weaponize it.
We have been, content with the thought that if we get vaccinated, that these various viruses will not affect us. Now, is that the case or not?
Well, yes and no. We've always known that the vaccines are not perfect, but they're pretty close to it. When they were first developed, the Pfizer and Moderna vaccines were about 95% effective against preventing any kind of infection from COVID-19. Now with this new Delta variant, that's a little bit lower. They're about 85 to 90% effective at preventing people from getting coronavirus. But the good news is that they're still about 95%, 94, 95% effective at preventing serious disease. So you might, if you've been fully vaccinated, you still might get COVID-19, but the chances of it being serious is still very, very low. You might have a mild case. So this is the information we have on the Moderna and the Pfizer vaccines. We don't have any data right now about how the Johnson & Johnson vaccine is doing against the Delta variant. We know that about 12 million Americans have gotten that J&J vaccine. And interestingly, yesterday, new research came out that showed that people who had the one shot of the J&J and had one shot of Pfizer or Moderna had an extremely robust immune reaction. And some health officials are voluntarily deciding who got the J&J vaccine are getting one shot of the Pfizer or Moderna. This is not recommended yet, but people who got the J&J vaccine who may be concerned about the Delta variant should talk to their healthcare providers and get their ideas on whether it might be advisable to get one shot of the Pfizer or Moderna for that extra protection.
Lori, thank you so much. And I might say, folks, I had the J&J and I had one shot and I've had absolutely no reaction whatsoever. I'm not even a pain in the injection site. It was just wonderful.
Yeah, I had the Moderna, a little bit sore arm, but I mean, nothing to write home about.
Well, I'm counting on this whole idea of your gut flora giving you about 80% immunity. And after you talk about the zinc and all the other things, I take care of all of that, and I'm hopefully going to praise the Lord, and He's going to keep me healthy.